This is part 2 of helping you learn to think like a nurse about DVTs and airplanes. Make sure you've watched part 1 because I go through steps 1 and 2 of the Silver Bullet study system, which covers what you need to know before you can even begin to think like a nurse about DVTs. To study DVTs on step 3, this is where we start predicting what's going to happen next based on what we know from steps 1 and 2. This is the most important step if you want to learn to think like a nurse. But it's the step that most nursing students don't even realize they have to do because nobody ever told you before. But this is the secret to how you're going to start doing better on your exams. Let's say a DVT occurs. What's going to happen next? Now let's think specifically about people who are on planes. What is it about being on a plane that's going to cause some step 3 symptoms that are going to make us think DVT? First off, remember the information from step 2 in the previous video. DVTs tend to be caused by venous stasis, which is going to happen if you're sitting on a plane, you're not moving around a lot, your legs are kind of folded up and cramped, so you're not going to do any vigorous activity, so your heart's not going to be pumping real fast. So the blood flow from your legs is going to be moving a little bit less than normal. That's venous stasis. The second potential cause is the little tears in the endothelium layer of the blood vessel. That one doesn't really have anything to do with airplanes per se. It's more of a pre-existing condition. But clearly the fact that if it's present, then people who have this are going to be at a higher risk of developing DVT on a plane than somebody who doesn't. So it's definitely a risk factor. Number 3 reason was people who are just more prone to coagulation. Their blood's a little thicker, it's more likely to clot quicker. Now, even though airplanes are pressurized, it can decrease the total amount of oxygen that you get, like having the changes in pressure that go with flying. And decreased oxygen levels can increase your coagulation. So this is another factor that can increase the risk of DVT a little bit. Let's take all that information to step 3 and say, what's going to happen if we do get a DVT? You might automatically think about Hohmann's sign, but that's not a very strong indicator because it doesn't happen for a lot of people. Often, there's no sign. It's just a blood clot that's stuck until it dislodges. So some of the most important things we would predict would be actually pretty serious complications of a DVT that has dislodged. And that would be a blood clot getting stuck somewhere else in the body that is no good. Think pulmonary embolism, stroke, myocardial infarction. So moving to step 4, what do we do with this information about DVTs as a nurse and a nursing student? We want to do things to educate the patient, to reduce the risk, and to potentially reverse the condition if we can. So we're going to educate people who are on planes. Make sure you stand up during the plane ride if you can. Walk around a little bit. Do things to decrease the venous stasis. If they take an anticoagulant medication, make sure you take it as ordered. Makes it less likely for a clot to form. And if you experience shortness of breath, signs of a stroke, or chest pain, get emergency help immediately. Thank you for flying with your nursing tutor. Make sure you like this video and follow for more nursing school tips.